Hello everyone. Today we are going to discuss an important topic in medical surgical nursing, which is pharyngitis. It is very common condition seen in clinical practice, especially among children and adults. Definition: the inflammation of the pharynx or throat is called pharyngitis. It is also termed as sore throat, which means the inflammation can be at the back of the throat. Sometimes this inflammation involves the tonsils and also the surrounding tissues. Pharyngitis can be acute or chronic, and it is common in all age groups. Etiology: it is mainly caused due to viral infections. The most common viral infections can be rhinoviruses, coronaviruses, adenoviruses, influenza viruses, etc. The bacterial infections. The pharyngitis can be caused by bacteria, very particularly streptococci. Allergies or irritants can lead to pharyngitis, inflammation of the throat. That can be smoke, pollution, dust, and also upper respiratory tract infections like common cold, sinusitis, laryngitis, tonsillitis can cause the inflammation to the throat, leading to sore throat or pharyngitis. Poor immunity or exposure to infected persons can also cause this condition. Poor immunity means where the immunity or the resistance of the patient is less, and that can lead to the inflammation of the throat. And exposure to the infected persons can also cause the condition. Types of pharyngitis: acute pharyngitis. It is rapid onset inflammation of the pharynx. Generally, it lasts for 3 to 10 days, and mostly it can be the symptom of an underlying condition. Chronic pharyngitis. It occurs and it continues longer than 10 days. It causes discomfort, irritation, and difficulty in swallowing. Viral pharyngitis is mainly caused due to viral infections, and bacterial pharyngitis are due to bacterial infections. Non-infectious pharyngitis. It is not caused due to any bacterial or viral infections, but it is the sore throat is caused, the inflammation of the throat is caused mainly due to allergens or irritants like smoke, pollution, etc. Pathophysiology. Pathophysiology: here the infectious organism enters into the pharynx. The infectious organism or any other irritant can enter into the pharynx either through inhalation or through ingestion. And after the entry of this organism or irritant into the pharynx, that can invade the pharyngeal mucosa and causes irritation, which activates the inflammatory response in the body, and there will be inflammation in the pharynx or the throat, which causes vasodilation, edema, and redness of the throat tissues. Vasodilation is the dilatation of the vessels, and edema is the collection of fluid or accumulation of fluid in the cells or tissues, which leads to pain, sore throat, and difficulty in swallowing condition. So, difficulty in swallowing can also be called as dysphagia. Clinical manifestations or the signs and symptoms for patients suffering with pharyngitis can be sore throat and pain while swallowing, redness and swelling of the throat, fever and malaise. Malaise means weakness. Enlarged lymph nodes where the lymph nodes are enlarged or swollen. Hoarseness or cough. Hoarseness means the voice will be raspy or stained. It is mainly due to vocal cord irritation, and there can be white patches or exudate mainly in the pharynx. So, in the pharynx, there can be white patches or sometimes even exudate. Exudate is nothing but the collection or the formation of pus. So, it can be mainly due to bacterial infections. This is the image where there is inflammation of the pharynx along with the inflammation. So, the tonsils are also inflamed, and in this we can see the inflammation clearly. Diagnostic evaluations. Physical examination of the throat, which reveals the swelling, redness of the pharynx. Throat swab culture, where a swab is taken from the throat and it is cultured to know which type of bacteria or microorganism is present in the throat. Rapid antigen detection test, so it can be done to identify the streptococcal infections, very particularly group A streptococcal infections. So it is this test is done very quickly. The result can be obtained within minutes. Complete blood count. Complete blood count can be done to know the count of the blood cells. In case if the infection is bacterial, usually the WBCs will be increased or elevated in the blood. In case if it is viral infections, usually the lymphocytes will be elevated or increased in the blood. And this complete blood count helps us to assess the severity of the infection. Assessment of symptoms and history. Here we ask the patient about the sore throat, presence of sore throat, fever, cough, and dysphagia. We ask the patient to express, to tell, to explain from how many days these symptoms exist. And also, we also ask them if there is any exposure to infected individuals, if they are exposed to any infected individuals leading to the condition or the disease in them. And also examine the throat for redness, pain, swelling, or any pus or abscess formation. Complications and patient education. If pharyngitis is left untreated, or else if the treatment is not properly done, sometimes it can lead to complications like tonsillitis and abscess formation. Tonsillitis is inflammation of the tonsils. Abscess formation is formation or accumulation of pus in the cells or tissues. And sometimes it can cause rheumatic fever, mainly due to streptococcal infections if untreated. The streptococcal infections can lead to rheumatic fever. Rheumatic fever means fever along with joint pains, and there is also sometimes the infection can be spread to nearby or adjacent structures. In the patient education, we educate the patient to complete the full course of antibiotics, which is really very important. If the antibiotic course is discontinued or stopped in the midway or the halfway, then the microorganisms are capable of developing resistance to that antibiotics. So educate them to complete the full course of antibiotics and maintain hand hygiene very particularly to prevent the spread of infections and all. Avoid sharing the utensils or the things. and advise them to consult the medical care if the symptoms worsen. And the patient should maintain good oral hygiene and also educate them to avoid exposure to infected people or irritants like smoke, pollution, or dust. Medical management, drug therapy. Drug therapy, in that we provide analgesics. Analgesics are the drugs that are used to treat or reduce pain. Example paracetamol, ibuprofen, and diclofenac. Antipyretics. Antipyretics are the drugs that can be used to reduce or treat fever. Example paracetamol and ibuprofen. Antibiotics. Antibiotics are the drugs that can be used to treat the bacterial infections. Examples can be penicillin, amoxicillin, azithromycin, cephalexin, etc. And supportive care is also equally important. Other than medical management, advise the client to have the warm water gargling and use the chlorhexidine mouthwashes to maintain the oral hygiene and encourage them to take adequate fluids and rest and provide them with a soft, warm diet as there is difficulty in swallowing. In nursing management, assess the pain and swallowing ability, whether they can swallow the food and how is the level of the pain. Monitor the temperature and the vital signs. Note if there is any changes in the vital signs and encourage them to take adequate fluids to prevent dehydration and to prevent the dryness of the throat and provide soft and warm foods, maintain oral hygiene, and educate the patient about the medications, so how to take or administer the medications. Pharyngitis is common but manageable condition. Early diagnosis can prevent complications. Thank you for watching.